Hello, friends. A very good morning and a very warm welcome to all the RFA champions who have joined Mrcog Part 3. And here we are taking the first step towards another success. Is my voice audible and clear to all of you out there? Hi, Aisha. Hello, Big hello. And once again, a big congratulations. Lots and lots of celebration in the last few days and weeks. Congratulations once again. We are again ready to set up the study schedule. We are again ready to make a very concise and a perfect plan to pass Mrcog Part 3. Yes, breaking barriers, RFA champions, conquering Mrcog 3 in a single attempt, RFA tutors. All right, so I'm sure that you guys have had lots and lots of contentment, but few of the students, they have been messaging me that it's been so difficult because now we are opening up and the November time is so closer. So here I am to tell you that we will be making such a perfect schedule where I would definitely be needing input from your side, because without your input, definitely, yes, we are incomplete and we together have to make it a success. Today, once we start this Mrcog Part 3 journey, I would like to give you examples. Shweta, Srija, my dear, hello, Deepak, big hello, my boy, that we have been doing it. And we had been doing it earlier also. People had been passing the exam, like clearing it in one go. With lots of testimonials, you can see on the page that they did their part 2 and then part 3 in one go very fastly. It has its benefits. Definitely, yes, it depends upon individual that how far you can your time to your studies. If you've got family commitments, we would discuss individually that what is the best attempt, because lots of confusions are there. Hi, thank you so much, Aisha. Absolutely, I'm here to tell you. Now, when we were taking this exam, we were not given an option because it was nothing like expression of interest, because it was before the COVID timings. Nothing was there as if like you cannot appear or something. I mean, because the backlog wasn't there, you aim for an exam and you take an exam. At that point, it was hardly 1.5 months, which used to be between the theory and the OSCEs. And all the theory students who used to pass, they used to clear the MRCOG OSCE just in the next attempt. They used to appear in that, right? You see worldwide all the OSCEs. You take any obstetrics and gynecology exam. You people would agree that OSCEs are never taken years and years later, right? If you see your obstetrics and gynecology in your countries, you would see that you pass a theory. Aisha, you would agree to it. Shweta, you would agree to it, my dear, that you just pass the written exam and you're just ready for the Viva. What is the reason for that? Reason is that your theory is prepared, right? Your theory is always prepared and you're ready with the written content. Now it's only that how you present yourself. Now it's only that how you are ready to move further in terms of speaking it up, in terms of presenting, because they want to see you that how do you carry yourself, and that is the gist of it. All right, okay. So you should not be feeling that you're not ready. This is number one. But at the same time, I would agree to the fact that it does require a transformation from the written exam to the speaking pattern, a transformation where you guys understand that we were preparing for the single best answers in the extended match question. Now we're going to talk to the patient to tell about PMS. Now we're going to talk to the patient to tell about the HMB, right? And it is time constrained. It's not that we keep on talking and talking and it doesn't match the scorecard. Whatever we have to speak definitely has to be in the scorecard. And unfortunately, it's just 10 minutes for patient, and in 10 minutes, we have to cover it up. For your encouragement, people who have been doing in one go, people who have been celebrating earlier, they were just like you. And now we have to take an oath before we start that you have to be here in RFA Champions. Let's cherish the beautiful memories just of the recent exam. time when they were taking the first step as well. There was a time when they had introduction as well. There was a time when they were full of queries and confusions as well. And you can see that because you are starting, you have lots of queries in your mind. For me, I've seen people taking the first step, the baby steps, and gradually moving towards the success. So who's going to be in the next board? You are going to be the next RFA champion. With all this faith, with all these prayers that we will hold each other's hands, and same as we have done MRCG Part 2, in the same way, togetherness as a family, practicing, making each other's weaknesses, turning them into the strength. This is going to be the aim, because definitely, yes, the times would come where you would be having dejection. Time would come where you would be slow, where would be you will have some sort of a low moods. There would be certain times where after the feedback you would feel, oh my God, how I can be better, where I can improve myself. So with all these, we need morale boosting. With all this, we need the togetherness, and we need to work hard together. Okay, absolutely. That's like my girls, Srividya, Aisha, Umma. Thank you very much, Sabangi Jat already. This is what we want. Okay, so let's take a start of MRCT Part 3. The first thing is that we need to understand. That's my girl, my sweetheart. So the first thing is that we need to understand what's the exam pattern. Everybody, please, I expect all of you to open up your notebooks, because there are certain things which I will be saying where you need to be perfect in, okay? Because we are going to start our first module, the maternal medicine. And there are lots and lots of things where we need to be smart at. Now, MRCT Part 3, as I'm telling you, that your written content has already been perfect, and that's why you've passed the exam in such a difficult result of MRCT Part 2 we had. Out of them, if you are among the passing students, that definitely means that you're all set for it. You know what is the theory part. How the MRCT Part 3 goes, it is a circuit. And when it is a circuit, it has got like 14 stations. In 14 stations, you've got a 2-minute reading time, and you've got a 10-minute actual presenting time. Now, so far from this attempt of November 2023, we do not have any online exam. All the exams being shifted to the centers and all the venues. We are going to discuss just in a bit what's good for you, what are the pros and cons, and where you should select as per your convenience and as per the ease of traveling as well. Now, when we say that it's a circuit, it's 14 stations. For each station, you will get a 2-minute reading time where you all will be standing outside the cubicle, and then it would be the 10-minute presenting time. The bell would ring and you have to move to the next station. You can't take, everyone please pay attention. I'm going from a very basal level because I know that you all are very new to the MRCT Part 3 format. 2 minutes means that you have to read at that time. You cannot take more time. If you are taking more time and you're not entering into the cubicle, you are definitely taking time out of your 10 minutes. Is this point clear? Because the circuit goes all together. All the students are outside the cubicle in these 2 minutes time. Every student is standing outside the cubicle in this 2 minutes time. When the 2 minutes gets over, it is going to be starting of a 10 minutes. So you have to be inside the cubicle at that time. If you're not going to start your station, that means that you are taking time out of your 10 minutes. Could you all get that? Am I clear about this? Oma has a question that can we take the watch? The smart watches are not allowed. However, the normal digital watch is allowed, but generally it's very difficult. 2 minutes, 10 minutes, 2 minutes, 10 minutes is the fastest time of your life. It's generally very, very difficult to keep on seeing your watch. And of course, when you're talking to the patient, Uma, and if you keep on seeing your wrist, it gives definitely a bad impression. You need to have an eye contact. So we are going to practice in a way. Pranita, we are going to practice in a way that we know that, okay, our history is ended. It must be like 4 to 5 minutes at the station done. So now we are doing our explanation is going to be another 2 minutes. Kindly be on the mute mode, guys. Srividya, my dearest. Thank you, sweetheart. Thank you. Okay, so did you guys get that? Absolutely, Pranita. The bell would ring. The bell rings at 2 minutes. Then everybody moves inside the cubicle. The bell rings, Pranita, at 10 minutes, and everybody comes out of the cubicle and move to the next. So the cubicles are 14. They're generally in a way that you keep on revolving. Do you understand? For example, Pranita, the students at number 1 cubicle will go to the 2. For example, in the email before exam, 10 days before exam, you'll get an email which would say that your starting circuit is 13. For example, Pranita, you are starting with 13. So they would send an email and everybody knows that this is my starting station in circuit A, B, C, D. Okay. So if you get 13, Pranita, you're going to go to 14, then 1, then 2, then 3, then 4, then 5, then 6. Do you guys understand this point? So if Pranita is starting from 13, she would be ending up at 12, right? Aisha Jalil gets an email that she is going to start at station number 3. So she would stand, for example, circuit A, station number 3. Aisha Jalil next will be 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 1, 2. Do you guys understand? I mean, you start from that station. Absolutely, Oma. 14 students. Everybody, please. Oma asked that 14 students start at the same time at different stations and then revolve as per their numbers. Perfect. This is the understanding which I wanted you to have. There can be multiple circuits in one day. For example, I was in circuit C, right? So when in that UK exam, it was A, B, C, D, right? So there will be circuit A, circuit B, depending upon how many registrations are at that venue, depending upon the venue, and circuit D. In different halls, these circuits are going on, right? So if I'm at circuit C, cubicle number 3, so I'm going to start from 3 and at 2. Maybe Shweta is like at circuit A and starting from 13. Same stations in same day would be there. 14 stations here, 14 stations here, 14 stations here, 14 stations here. One day has similar stations all around the globe. Okay, but the next day the stations are different. The previous day the stations are different. Do you guys understand this concept, please? Everyone, did you guys understand that? Yes. So 14 stations would be there and everybody would be having those 14 stations. 3 would be the same, 2 would be the same, 1 would be the same, but you will keep on revolving without any break. 2 minutes, 10 minutes, 2 minutes, 10 minutes, right? So if you're in different circuits, your role plan would be different, your examiners would be different, but the stations of one day would be similar. Do you guys understand this point, that how the circuit goes? And we don't have any break station. We don't have any preparatory station. This is specifically, I'm telling about Mrcog 3Y, because the students should be knowing we do not have the preparatory station. Why? Because in European board, in MRCPI or SKI, we do have preparatory stations. We do have the rest stations as well. Okay? Here, we do not have any rest station. It goes, just keeps on going, 2 minutes, 10 minutes, 2 minutes, 10 minutes. That's why in the end, I will tell you that like I used to coach you for extended match questions, stamina building, right? Having a focus at the last 10, 15 minutes are very important. Similarly here, you tend to get exhausted when the circuit moves by because lots of ups and downs. If one of the station goes a little unwell, you guys have got lots of feelings. Oh my God, how's it going to be? And it starts affecting your new station. So this is what I'm going to train you in these sessions, that whatever happens, please leave that there. And then every station has got its individual marking and you can pass if you keep on fighting till the last station. Got it? No change over time, Rashida. No change over time at all. Generally, the stations are back to back and they don't keep it too far away. The cubicles are very closer. And at times, be ready in certain venues. The students, they do tell that they could hear the other student talking in 10 minutes and the other examiner talking in 10 minutes. The cubicles at times are very closer. So you should be ready to be very focused and try to stay calm, even if you're hearing voices in 10 minutes presentation. Okay, so no shifting over time. In Oslo, they used to keep 30 seconds for shifting over from one screen to the other in online exam, but in on-site, it is absolutely 2 minutes, 10 minutes, 2 minutes, 10 minutes. Am I clear so far? Did I make it clear that how the circuit is? I'm starting from the very basics because now I want that from today, we start preparing and we just make it a success in the next exam. Sheetal, clear? Yes? Clear? Okay, perfect. Thank you. Now, what are these 14 stations? Because today, if we understand that where the marking is more, what are the types of the stations, what are we expected to speak, we would definitely be in a better position to ace the exam. Okay, so we have got SDs. You need to understand this because I would be using that in the live session so much. Like you're going to have your maternal medicine first. Structured discussion are 4 in number. Simulated patient task is 6 in number. And simulated patient task with the lay examiner are 4 in number. What does that mean? In structured discussion, it's just simple viva and OSCE with your examiner. So it's just like in the cubicle, 2 people are sitting. That means that it's you and it's your examiner, and there is no other person to evaluate or to talk with. Your examiner is going to discuss certain things with you. For example, the examiner might discuss the topic of like postpartum hemorrhage. Examiner might discuss the labor ward prioritization. But here, the marking would be just by examiner, and you're going to talk in the medical terms because you're talking to an obstetrician and a gynecologist. Right? So here you have to talk about the doses. Here you have to talk about the strength, the pharmacological names. You're going to talk about the diseases. You're going to talk about everything which is the medical language because you're talking to your examiner. The problem starts that it's never that 4 structured discussion would be in a go. Then all the simulated patient tasks are there. The problem is that throughout the 14th circuit, you have to keep on changing your attire. And here comes the art of practice. Here, I want you all to be so crisp that you're talking to the examiner, you're ready that yes, you're going to say erythromycin, you're going to say penicillin for the medicine's doses when it comes to the preterm labor or the preterm pre-labor rupture of membranes, when you're talking to the examiner for a structured discussion. But you are going to switch over immediately when you're talking to the patient. Because if you speak medical jargons and when the patient is in front of you, the score starts getting reduced. You have to transform yourself to a layman language, a normal, simple language, which is understandable to your patient when you come to the simulated patient task where we have got 6 stations. You can have first structured discussion, second SPT, again structured discussion. So they're random. So you keep on switching up like your tone, your attire, and you keep on changing your language as well. Do you guys understand this point? Am I understandable on this? That where you have to understand that students, they tend to fail. I'll give you a very common mistake with students they do. We have a hysterectomy station as a structured discussion to tell about the steps of the hysterectomy, right, Uma? At the same time, we've got a station where we have to tell about, debrief the patient that she had a hysterectomy and there was some complication, and we're talking to the patient. So you talk to the examiner, you put the clamps at the round ligament, you do the clamps step by step at the uterine and all the pedicles. And often in mock, we see that students, they keep on saying, all right, so we are going to hold the womb and we are going to take the next, and then womb would be under the clamps. And it's why? Because they start using the terms to the examiner of the patients. It's a uterus. Do you guys understand that where the mistake happens? And commonly, when you're talking to the patient, you start doing the bombardment of big jargon, like medical language, where she's blank and she's not understanding. So please make it very sure. If it's a simulated patient task, It's going to be you as a candidate. It's going to be your examiner for assessing you, and it's going to be a role player. So 3 people will be sitting inside because it's a simulated patient task. All right. Now we have got the most important stations, which are the lay examiner stations. You will get the lay examiner stations for, but the most important, why I say, and I tell the students very confidently that if your lay examiner station goes perfectly smooth, there are 90% and above chances that you're passing this exam. Why? Because here you've got 2 examiners to score you. You've got a patient inside, you yourself inside the cubicle, and 2 examiners. That makes a total of 4 people inside. One of the examiner is an obstetrician and is going to assess you on your clinicals, like your applied clinical knowledge. The lay examiner is not about the content of the clinical knowledge. Lay examiner is about your communication, your attire. So generally, in lay examiner station, we get stations like breaking bad news, right? We get stations like domestic violence. We get station like cancers, malignancies. We get stations like angry patients, right? All these types of stations, they come in the layman examiner station. Why? Because they're assessing you some stressful stations like being angry, being upset, or maybe negotiating stations where the patient is asking for something which is not right for her. Do you all understand? Guys and girls, are you with me? Did you guys understand that why layman examination stations are important? Because the marks are more, the scoring is higher, right? And these are generally a difficult communication station. Okay, perfect. So this is generally the cubicles are like, and they're marked. Like, for example, this is circuit B, and you can see 4 and 5 station. So you keep on moving, keep on moving, keep on moving. And this is how the circuit is. In the center, generally, there's a table where the water is available. The bell rings in the center table, and the coordinator just keeps on guiding you from the circuit to circuit, from the cubicle to cubicle. Clear, everyone? Yes? So this is how it looks like, just a general idea. So you start preparing yourself. So just to have a better understanding, please, if so many people are here, the candidate, the role player, what is the type of the station when you've got 4 people inside the cubicle? What do you expect in the station? We expect it's a lay examiner station. Very well done. Amazing. So can I know when you and examiner are there? What type of station is this, Deepak? Deepak, if it's only you and examiner inside, so it's only 2 people inside. What is it? Very good. It's a structured discussion. And when it's 3 people inside, we don't have a lay examiner. It is a simulated patient task, but we do not have the lay examiner here. It's a role player talk and a chat with the role player, right? Now, why we have to work on the lay examiner stations a little more, and we have to be good in our communication because the marks are more, right? And because one key is with the clinical examiner and the other key is with the lay examiner. So 2 people are marking you for that station. If it goes well, definitely, yes, the score goes higher. And if it goes a little towards the borderline state, definitely, yes, your marks go down because 2 examiners are assessing you in that, right? This was the first thing, that what are the type of the stations? Now we have to understand that how Aditi, Shivata, Shweta, Pallavi, my dear, Pranita, how are they going to mark us? You have to understand that no matter it's a known station, a repeat station, a repeat topic, or an alien topic, or a new topic, you should not fail any station. I always tell the students that we should not fail any station. There's a reason for that. Because certain content of the station we know. They give you a new talk article, maybe they give you just atherosclerosis station, 2023 talk article station. It's a new one. But we know the history taking. We know how to communicate with the patient. We know we have to involve the heart colleagues and the cardiologist there. Maybe we are not very clear because we have not read the talk article. See, we have to understand that the gist of the station, we should not forget. The problem arises that when we think that, oh my God, this topic I don't know, and we have lost the station. It's not like that. Certain content of the station we definitely know. But what we do is that we just get overwhelmed by, no, it's a new station. We don't know that, how to just deal with this, how to just overcome the nervousness. And then under the nervousness, we don't even take the history, which is wrong. Right? Absolutely, Shweta. Please, my dear, go ahead. I'm going to accept you again. Do you guys understand? Now, the examiner has got the key, Deepak, as per the domains. He's got the key: information gathering, communication with the patient, communication with the colleague, applied clinical knowledge, and patient safety. So every part of the station is different. Why should I be thinking that, for example, if it's an alien station, I won't be able to do that? You know the content. Maybe one part you are weak in, but the other parts are the same. Exactly, yes. This is what I mean to say. We would do all the stations, repeat stations, but for example, if you do the maternal medicine, I will do the pulmonary hypertension, but I would tell you outline that how to solve any cardiac station if it comes. You know, I will do the Graves' disease, but I would tell you that how to solve for any autoimmune station if it comes. Do you guys understand this point? Because we have to divide our station into sections because they are marking you as sections. All right? If any part is weaker, it's not a problem. That part doesn't affect until unless under the nervousness or under the confusion of that part, we start having an effect on other domains. It is a domain-wise assessment. Please understand from day one. And your result comes this way. They say, oh, ma, in the result, unfortunately, if somebody is not passing, the result comes as the communication with the patient was not meeting the standards. Do you guys understand? That means that that particular student is getting communication with the patient weak in multiple stations, failed in multiple stations in communication with the patient. So result comes domain-wise. And information gathering is meeting the standard. Applied clinical knowledge is meeting the standard. Am I clear, everyone? Did you guys understand? Yes? So how it is said, they basically give you all the result card is this way. You keep on touching the score. They keep on marking a tick on this. Nobody can score you from themselves. There's a complete score sheet with the points important. Right? So when they mark you 2 for that domain, that means that you're passing. If they mark you 1 for that domain, that means that you're borderline. And if they mark you 0 for that particular domain, that means that it is going to be something where you're failing. So multiple domains in different station, when they are at the failing point, that means that you need to redo that domain, of course, and the exam has to be taken again. All right? Rashida, generally, yes. But just like this, in this exam, students, they message their result card to me saying that, ma'am, we could not meet the expected standard in extended match question, but we have passed the exam. Many students got this result, especially at 65%. So overall, they're passing because they reached that centile of 65%, okay? So for you guys, you people have to remember that last time also, one of the domain was not at the standard, but they just passed on the words, like just on the passing percentage cutoff. So generally, it's always ideal because I always suggest that we have to aim higher. You guys aim for 80% and 90%. Definitely, yes. At least you will reaching to the passing percentage. All right. Rashida, we would aim passing all, but if 1 or 2 goes borderline in 1 or 2 station, then it is covered up. I mean, as per the experience, it's covered up. Right, Oma? Yes, you're right. So for each as per domain, the score, if you people have to understand this, for example, it's a structured discussion, and structured discussion is being assessed for 3 domains, if yes. So it means 6 is the score for the Sheetal, please see this pie chart, my dear. So for example, this is a structured discussion, and we've got four structured discussions, right? So structured discussion has got patient safety, applied clinical knowledge, and communication with the colleague. So that makes six. One structured discussion contains six score, and there are four structured discussions, so that makes 24 total score in your exam for a structured discussion. It is a rough idea to tell you, which we were taught in the college, that how basically you have to analyze that how much is the score. So out of that, if you get like one borderline in one of the station, maybe another borderline, so this is how the total score would be reducing. Do you all understand? Similarly, if it is an SPT, total score is 48. How? We've got four domains if being tested. Two is for each domain being the highest. So 8 is the total score for each. 6 are the number of the SPTs we have. So 8 multiplied by 6, 48 score for your simulated patient task. Now, the lay examiner stations, they have, as a clinical examiner, 4 domains, but the lay examiner has got 3 domains. They do not have the applied clinical knowledge because they're not of obstetrician, as I've mentioned earlier. So they're going to be 32 score with the clinical examiner and 24 score for 4 stations. With your layman examiner's total score is 56, right? This is how the complete outline is. So if you understand as a pie chart, 56 makes bulk of your score, these 4 stations. 48 is for the other 6 simulated patient task. And in the other, we have got a structured discussion, which is the last one for this. So all of you have to understand and grasp it, please. Again, it is a competitive exam and it's percentile. It's in comparison to others. If the percentile goes higher, like when Rini got the gold medal from RFA, she was scoring above 80, 84, 85. So when she was scoring this much, so definitely as the result percentile, that went higher as well. Okay, so it depends upon what is the highest percentage in the comparison. I always say that in a circuit, it's generally impossible to fail all the students. If it's a difficult station, it's difficult for everyone. If it's a known station, you have to do wonderful. Why? Because it's a comparison. Like you are going as station number 3. Before that, somebody did that station. After that, somebody's going to do that station. So it's a competitive exam, and you're being compared to the person who just left before you and the person who's going to come after you. So definitely, yes, the marking does matter in this comparison. Do you guys understand? So 14 in a circuit. Imagine the examiner is assessing the 14 candidates. So even if it's a difficult station, even if it's a new station, try to do the best so that out of them, you are amongst the top. Do you all understand this? Because the whole 14 stations, the circuit is being just going on. And you, if you're better than your colleagues in that circuit, definitely, yes, the chances are that even if one has to pass in that particular station, which is a difficult one, that should be you. All right? Am I clear about this? Because the examiner is assessing. If you, Umma, would be sitting and you will have 3 presentations, you would also be able to understand, yes, number 3 was the best. Because then you keep on passing through the same stations, and the examiner does know that what are the major mistakes being done. Am I clear, please? Okay, so before I reach to the domains detail, I would like to know that, did you guys understand that how the exam pattern is, Aisha? Did you guys understand the exam format? Did you guys understand that how the scorecard is domain-wise? Did you guys understand that what are the types of the station in 14 stations we are going to encounter? Any queries so far? Because now I'm going to explain to you guys the domains, because from next Sunday, you people have to start your presentations, and then you will find a different version of ma'am giving the feedback, being strict, being sometimes making you comfortable, because very minute details at times, they do matter, and we have to understand and learn it together. To 1 to 2 presentations, you people would just be on the right track, and you people would feel in your self-evaluation. In my notes, I always write and compare the active participants with one another, and you people would see that improvement would be there. But the more we are going to speak, we are going to learn. Any questions so far? So before we go to the domains, please. I'm here for the questions. I can see Anam also here. Thank you very much, Anam, for joining. Anam, your session is in the evening, yeah? Yeah, 2 p.m. GMT. I'm going to take you guys in MRCP. Thank you very much, Anam, for joining in. Happy to have you here, sweetheart. Thank you. All right, all perfect? Yes, Aisha, did you understand, my dear? Thank you, my dear Anam. Thank you. All clear? 3 domains will be checked. Generally, yes. Generally, information gathering is not there, but it can be 4 also. You have to see the domains. This is the first thing. Very good, Deepak. Okay. Now, what do you guys think is the most important part in the preparation of the OSCE? From day one, you people should be fast readers. If in 2 minutes, at times it can be like 4 pages also, this is your cubicle wall. It can be like more than 1, 2, 3, 4 pages also. So you should be able to read very, very fastly. We would be taking the mock exams before the actual exams, and we would be doing, already we have started the meetings, we will be doing more sheets practice with you guys, especially in 2 to 3 stations, so that you know. Reason for that is that if you don't have a situation awareness where you are, what is the case, right? And if you enter into the cubicle, definitely the confidence is shaky. Definitely the presentation is not up to mark because you guys do not understand that what is the gist of the station, what did the patient want, and where I have to concentrate more in 10 minutes, right? This does happen. Generally, they don't give like too long stations, but 2 to 3 are expected to be very longer sheets and too much of an information. So from day one, we have to work on our 2 minutes outside the cubicle and be fast readers. This goes specifically for the MRCG2 students because in MRCPI it doesn't happen. It's a time which is just inside, and generally only 2 to 3 lines are there. They don't give the big stations. But in MRCG3, we do expect 2 to 3 stations to be very long to read and to comprehend the gist of the station. All right. So in 2 minutes, you have to be super fast. Like I used to tell you that extended match question, please do not do at leisure, do with time management. Remember, I used to tell you that please keep a timer and then solve your extended match question similarly. Here, what you have to do is that you have to put a timer, and whatever is the station when you're preparing in your study groups, when the moderator is giving you, please read it with 2 minutes time. Okay, Sheetal, generally, yes, they give you a writing pad where you write the important points. When we'll be practicing the stations, I will tell you that what in 2 minutes I would do. So you'll start learning gradually. For example, BMI being higher, the blood group being negative, or for that matter, the age, if she's an elderly pregnant patient, these type of things, Jehovah's Witness, all these things are important to write down. I will tell you specifically, and we would practice it in 2 minutes, that what are those things which we have to specifically learn. Okay. Yes, Uma, I will tell you when we'll start doing the maternal medicine. From today, your moderator would also start coaching you for this. Okay. In information gathering, which is the most important domain today, I'm going to explain information gathering to you guys in the end, and we will just learn good information gathering. There's a reason for that, and I would justify why I stress upon information gathering so much. History, examination, asking for if any investigations are done, or is information gathering. So you have to follow the template. You always start with the presenting complaint, what patient comes up with. She comes up with vomiting, ask about the vomiting. Always ask an open question. You ask the details of her complaint here, that what exactly has happened, since when? Did she take any medicine for that? And is she improving after this? What associated symptoms are there with this? Then the obstetric history about the pregnancies in the past, about the gynecological history. Also, you need to ask about her periods, maybe about her smears, okay, about the cervical screening. The medical history, if she's seen GP regularly for something, the family history, any concern, which you should be knowing, surgical history, the drugs, the personal history, the social history, and how had she been feeling generally in the last few weeks and months in terms of her mental health inquiry. Okay. All these in a go, you should be remembering. I used to just link them with one another. For example, I would take the presented complaints, would do the HOPI. If it's an obstetric case, then obstetric history would be the first one. If it's a gynecological case, for example, HMB, PMS, endometriosis, then gynae history. So these two are switched over. Am I clear? For example, your first session is maternal medicine. So obstetric history will be the first one because it's an obstetric case. Do you all understand? They are switched over according to the presenting. For example, it's a PMS, then gynae history would be the first one. And then the obstetric history would be coming. Am I clear? Am I clear, please? Everybody, did you get this point? It's important because being organized in the history, that makes you very strong in your station. Then comes the medical history. You don't have to go into detail. Any medical illness for which you see your GP regularly, this one statement is sufficient. If she has a medical problem, then it won't here. Then it would be in HOPI. Do you all understand? For example, if it's a Graves' disease, an important recall station, a Graves' disease with pregnancy, then that would not be here. Then it would be pregnancy questions and the Graves' disease questions in the HOPI because it's her presentation. Clear? So if it's a known medical history, you would ask here any medical illness for which you see your GP regularly, any family history of concern. I used to clip them up with medical history for herself and then for the family history, then surgery, any operations you had on your tummy or down below, any medications you're taking, do you have any known allergy, do you smoke, do you drink alcohol, pardon me asking, do you take any recreational drugs, what do you do to live and how is the support at home, how had you been feeling in the last few weeks and months? Information gathering is done. Now, the second domain, I'll come back to information gathering because I have to explain that to you guys, but I'll cover the just to hold the domains, okay? Communication with the patient is the most important domain. And few of the students who have got the language barrier, they do have difficulty in this domain generally. Reason for that is the fumbling is more if the communication is not smooth, and that definitely shows a lack of confidence to the examiner. Now, why communication is important? Because, see, for example, if you're taking the information gathering is like maybe 3-4 minutes, the starting of the station, like we gather information, right? But here, the communication starts from hello until the bye-bye. Yeah? So complete 10 minutes, you have your communication. You should be able to make her understand that what is her condition. You should be able to get engaged with her in talking, all right? Okay, yes. Keep on nodding your head. Keep on giving the affirmation sounds. For communication with the patient, you should be able to negotiate perfectly because, for example, it's a PMS station. She says, no, I don't want these medications. She declines taking SSRI. She declines taking COCPs. She says, I want Vitex agonist. My friend was using that. And I think that's the best. So you should be in a perfect position to tell her that what the complementary therapies are. And how can we just tell her that without doing some sort of respecting her autonomy. And we have to tell her that what's better for her in a very sensitive way. We should know how to negotiate. Another station, for example, she is previous to cesarean section and she wants a home birth. So first of all, the VBAC is risky for her, for more risk of a uterine rupture. But she says, no, doctor, I want to deliver at home. I've got a fantasy and I've got a very bad experience earlier. I just want to deliver at home. So it is the art of communication with the patient where your negotiating skills are being assessed. And generally, these type of stations are layman examiner stations because the patient gives you a tough time. They're not much, maybe one in a circuit, but we should be ready for that one station also. Do you guys understand this point? Everyone, do you guys understand this point? Yes? Okay, for students are asking for the link, and here we are. Okay, all right. So after this, you have the next domain in which the communication with the colleague is being assessed. Now, in communication with the patient, please avoid having the pitfalls, which are like, you forget your introduction. What happens at times is that students, they enter into the cubicle and they just forget that where they are. It would be written that it's an antenatal care clinic and they would be saying, yeah, we are here for the in one of the clinic today. Maybe they'll just speak up early pregnancy. Why? Because they had the early pregnancy assessment, the previous one in the cubicle, because it's back to back. It's very difficult in the MRCG3 exam that you just forget what you did just 2 minutes back, and you have to just transform yourself into the next cubicle in the next scenario, right? In communication with the patient, be very, very careful in asking the question specifically when it comes to the sexual life, it comes to the signposting, sensitive, multiple partners, HPV stations, cancer stations. Be very, very sensitive and empathetic in that. If you be blunt, if you be without your sensitivity, it tends to reduce your score and the patient gets uncomfortable. Patient might feel awkward and you lose your score in the communication with the patient tends to be towards borderline and failing. Okay. Never hesitate asking the question regarding smoking, regarding alcohol, because it is not something which is abnormal. We need to inquire as doctors, or you can just say, as part of my general inquiry, may I know, do you smoke, drink alcohol, any sort of a recreational drug? So you should ask it because it's part of the general inquiry. She does have an effect on her health. Okay. So some students, they find it so awkward and they feel so shy to ask these questions. It should not be. Be confident, right? Because this is something which we need to ask. Now, you have to practice more to improve your communication with the patient. You have to make sure that you know that how to give information in chunks. Do not keep on giving the complete information in one go. And this is the biggest, I would say, flaw, which I see when it comes to the mock exams. I will give you an example. Everybody, please pay attention here. If you know some topic really well, for example, just an example, it's PMS, and you all know the algorithm perfectly on your fingertips. You start the station telling about the condition PMS, and Aisha, you start saying, yes, we've got the stepwise management. We've got the first line where we give the hormones and we can give certain medications which release the happy chemicals in your blood. And that improves the symptoms and the mood symptoms are improved on this. Then we have got another one where we can increase the dose in the second step, or we can give the patches also. We can give a hormone coil inside the womb. If it doesn't work, we can give you injections, and we have to give the hormone replacement therapy with those injections. And if nothing works for the patient, we intend to do the removal of the womb with the ovaries, but it would be the last resort. And you start saying like a train, chick, 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 complete till the end. And your applied clinical knowledge, which is the knowledge of your information that might pass with this, but your communication with the patient will be failing. Because when you know a lot, you're just in a hurry to tell everything quickly. Because you think that, oh, time is less. At the back of your mind is the stress of the time. Too much information in one go makes you fail communication with the patient. Please, after each step, just break the information. Are you with me? Are you following me so far? Am I clear about this? Do you all understand? So checking understanding is vital in giving the information. This is the biggest mistake with students they do, and they fail the exam. Always check understanding. And it doesn't take too much of a time. It takes fraction of a second saying, are you with me? Are you following me? Am I clear so far? Do you want me to repeat anything? So please write in your notes 4 to 5 statements which would make you pass in the communication with the patient along with applied clinical knowledge. Okay? Communication with the colleagues is the easiest domain to pass because it takes less than 30 seconds to pass this domain. However, unfortunately, this is the most missed domain also. It's a preterm labor station. Why do we forget the neonatologist? Why do we forget the nursing team in the neonatal intensive care unit? It's an oncology station. It's a cancer. Why do we forget the MDT? You at your part of the world may be handling all the medicine, the diabetes, the thyroid, the labors, the resuscitation, everything yourself. It depends upon where you're working. But in MRCOG, remember, that you have an MDT for everything. Please involve the colleagues wherever required, even if it's an anesthetist, it's an obesity patient, you need to have the neonatologist concerned, anesthetist, you need to have a specialist midwife, whosoever is involved, please involve them in the management. This is the most important thing to pass this domain. And I always say this domain needs 30 seconds out of your 10 minutes. Is it difficult for us? Everyone, is it difficult for us? Deepak? It's not. Shubhangi, my dear? Is it difficult? It's only that we forget. We know who is going to be involved, but we forget that, right? We should be knowing if we are being assessed in this domain. The first thing, everyone, please pay attention. Today, I'm telling you in the start of the course, and I'm going to be strict on this. In 2 minutes, write down for yourself. The first thing you would see is, are you having a simulated patient task or a structured discussion? And what are the domains for which you're being assessed so that you fulfill that domains? And throughout, if this is the station, everyone, please, the station which is outside the cubicle, this is your cubicle. The station is outside. This is the table inside. The same station is pasted on the table as well. Do you guys understand this point? Outside, 2 minutes reading time, you see that on the cubicle wall, right? Inside, you're sitting here. This is on your table. The same station is inside the table as well, right? Now, what I used to do for myself, I used to keep my index finger on this station, right? While talking, I used to keep a look. All right, my domains, this is done. Information gathering done. Communication, I'm doing. Communication with the colleague, okay, when I'll come to the management, I'll touch it there. Keep on evaluating yourself in 10 minutes. Do not just keep on starting like in a blind way and just keep on doing it without any self-assessment. In 10 minutes, keep on assessing yourself. The task is in front of you. Keep on analyzing yourself. Do you guys understand this point? Because it's very, very important that you see those domains inside and see that, okay, my domains are being ticked. Why? Because the examiner is marking you on those domains. Understood, Pallavi? Examiner is marking you on those domains. So please see those domains inside also that, yes, I am going in the right direction. Hi, Rahat. You're always in OPD and clinic, my dearest. Yeah? Thank you so much for joining in, sweetheart. My pleasure. Thank you very much, my dearest. Very happy for your result, honestly. Thank you, my girl. Thank you. Yes, thank you. So communication with the colleague, please do not forget and always involve the colleagues whosoever is required. Okay, right, Pallavi? Right, Rahat? Thank you very much. So always when you have to give an information, do you guys remember the extended match question of strategy we used to do? Oma? Yes? You all remember, Deepak? What is the communication tool which we use? There was a strategy, single best answer, SBAR. I used to tell you that here you get it as a single best answer. And in the part 3, we are going to practice that. So now is the time that we have to practice the SBAR, which is situation, background, assessment, and recommendation. This is a handover, communication handover tool. For example, you are in ST5, your consultant is at home, the on-call consultant, and you have to give some piece of information to her. It's a patient with you in a preterm labor. So you have to tell that what is the situation, what is the background, and what is the assessment, physical examination, and what do you recommend for this patient? And then you're going to take the decision from the consultant also, okay? Rashida Arif, we can read inside the cubicle, but the role player is in front of us. We could scan. For example, if you have not read the station outside, you can definitely take a little time inside also by saying that, may I just take a few seconds to complete the station. The examiner allows you to do that, but rest assured that if you're doing that, you're taking time out of your 10 minutes, right? Yes, so we are taking time out of our 10 minutes from this. So we need to be faster, of course, because any time which we are taking, that's being taken from our presentation time. All right. Yes, we mentioned, Oma, we mentioned that we've got a patient and this is exactly the situation. So in the past history, she has this. On the physical examination, this, and I would recommend. This is how we do the SPR to the colleague. Okay. In communication with the colleague, we might get certain other stations as well, like that of the talking to the role player for the junior teaching. So teaching is also communication with the colleague. With multiple teaching stations are there, I will just tell you that what is the format and what are those things which you have to do, right? The patient safety, I will be very strict at, and this is the reason that if you open up your website, I've made a complete patient safety folder for all the modules. Unfortunately, this domain is the most failed domain. There are two reasons for that. Everybody, please pay attention here. The reason number one is that patient safety, they're very sensitive on that. If they're giving you MRCOG degree, I mean, they're just telling you that yes, you can write MRCOG with you. They have to be very sure that you are patient safe. Of course, patient safety is something which is important when it comes to mistakes in the clinical practice also. So this is the reason that generally students, they fail in patient safety. Another reason is that students have a tendency to forget the patient safety while doing the station. When you're confirming the name and the age of the patient in the start, you know that this is how we start the station. You should be knowing that confirming the identity of the patient is also communication, but it's also patient safety, that we are meeting the same patient who has the investigations and the patient, they're the same. Allergy we ask in the history, but it's a patient safety. We need to document the allergy to save the patient from any sort of an allergic reaction. Examining the patient in the presence of a chaperone, it's a patient safety. When you say that I would like to examine you in the presence of a chaperone, would that be okay for you? So we are saving ourselves and we are doing the patient safety there as well. For any decision in your patient station, you have to be clear that we have to make sure that we do all the decision taking as per ST5. This is a very sensitive and a very important point in patient safety. As an ST5, there are certain things which you're allowed to take a decision. Do that, please. But at the same time, there are certain things where you have to inform consultant as well. I give you an example. The patient is taking enalapril, right? And you are there with the patient, you have to change. She has been taking this medication from the doctor who's treating her hypertension. You should be sending back a talking to that doctor to change the medicine. Do you guys understand? There's certain things where you need communication rather than being very fast and taking decision. You should not adjust the thyroid hormone doses in terms of like the thyroxine or for that matter, the propylthiouracil. Yeah. So this is against patient safety, but at the same time, if there's a fetal distress and you think that it's something which is typically there is no confusion in that, you inform the consultant, but you have the authority to take a decision for the emergency cesarean section also. So you should be knowing that what you can do, what you cannot do, depending upon the severity. This is the biggest problem with students. They say, for example, if you're calling the consultant for something which is ST5 expertise, your patient safety goes fail. And if you take a decision which is beyond the expertise of an ST5, your patient safety goes fail. So here you have to be very clear on this. What you can do and what you cannot do, where you have to call the consultant, where you have to discuss with consultant, and where you have to take immediate steps because you are the leader on the duty. Okay. Similarly, Jehovah's Witness, risk management, all these, contraception, all these, they come. All these things, Aisha, there's a complete folder which we would be giving you, and that will be there. You can write in the group now. Safa can post that for you just now also. Okay, just tell the moderator to write for the what are the capabilities and the things which ST5 can do, my dear. Just now she'll give you that folder. In patient safety, students, they make this mistake, okay? So clinical governance audit, all these stations, they come in the patient safety also. I would be discussing that in detail with you guys. And you should be very clear about the recommendations. Any sort of a wrong prescription fails you in the patient safety, wrong medication. If you miss up that she's penicillin allergic and you give penicillin for intrapartum antibiotic prophylaxis, you fail the patient safety, you know. These type of things you have to be very clear. They give the penicillin allergy so commonly. In one of the station, definitely, yes, the patient is allergic, right? So make sure that you know the right doses, that you know the right checklist for the prescription. You know that if she's allergic, you have to write down. This station is your strength because you've just been through your MRCT Part 2. And this station is a little difficult for those who have taken the MRCG2 a little earlier. So please do revise the recommendations of GTG, NICE, the recent talk articles. Please do not go through the complete day for one guideline. It's not a part 2 exam where it would be SPS or EMQs. It's part 3 exam. It's communication. You just have to take the gist of it, right? But please do not be very random. For example, doing the first line management, doing the fourth line, then doing the second line, and doing the third line. You want to be very organized. That it should not be a scattergun approach. That the management plan when you're telling to the patient that should be perfect in terms of a sequence. That how beautifully you can just put into words. The applied clinical knowledge should not be a problem for you. For you guys specifically, your notes are sufficient, which I've made for your master part 2. You can just open up your notes and do only those notes for the recommendation sufficient, okay? Outside the cubicle. So before I go to the outside the cubicle, any questions from the domains, please? Because now another section would be starting up. Any question from the domains part, please? What is in the information gathering? What is in the communication with the patient? What is in the patient safety? What is in the communication with the colleague? What is in the applied clinical knowledge? Am I clear that in different domains, what things you have to cover and how you're being scored in those domains, please? Am I clear? Communication with the colleague? No, Sheetal, communication with the colleague means, for example, if you've got a patient, then communication with the colleague is that who is going to be involved for the treatment plan? Who else? Okay? Absolutely. Absolutely. When you start the station, this is your station. It starts with, this is a simulated patient task and the domains being assessed are these. The starting of the station, the first line of the station makes you know that what domains you're being assessed. This is the starting of the station, my dear. Okay, right? Great. So, ma'am, will we do the examination? But we will mention about that. No, Aisha, no touching to the patient. Everyone, please. MRCOG3, you do not touch the patient at all. It's not an MRCP where you do the examination here. You do not have to touch the patient at all. You have to enter into the cubicle. You just have to sit on your chair. You have to speak everything and you have to move out. No touching in the real exam. Okay? No touching, Aisha. It's all about talking. It's all about communicating. That's it. And I always avoid after the COVID specifically, no shaking hands, no getting closer. Sit on your seat, which is already there, and move out. That's it. 2 minutes, 10 minutes, 2 minutes, 10 minutes. All about speaking, no touching at all. Okay? Right? Yeah? Rashida says will be more clear. Absolutely, yes. Next session, absolutely, yes. And when we just mentioned that I would like to examine, yes. What did we say? I would like to examine you in the presence of a chaperone. Would that be okay? She says yes. Or you say thank you. And then you could come into your management plan. All right, you just say and you just move, touch and go. That's it. Got it? Absolutely, we say that just for the sake of saying. That's it. All right. So in 2 minutes reading time, generally the 1 minute is going to have the reading carefully part, the reading part. And this is what you people have to understand. 1 minute, please organize yourself. That how you're going to enter into the cubicle, how you're going to start your station. All these things are important that you organize yourself. All right? Absolutely, my dear Malabika. No examination at all. Okay? Now, how do you make an outline of the station? Aisha, everybody please pay attention. All the newcomers, please pay attention here. Uma, you do an introduction. You make an agenda, right? For example, hello, I'm Dr. Aisha, one of the doctors in the antenatal clinic today. May I confirm your name and age? Is it okay? I call you Anne. I've gathered from your case notes that you're here today because you're pregnant for the first time and you're here to book your pregnancy. Is that right? I will be asking a few questions to know more about you. Would that be okay, Anne? And then you do all your information gathering template. In 3 minutes, you complete your information gathering and you say, thank you for this information. Do you have any concerns for this consultation? And then you start the management plan. In the management plan, you should have an outline because she is pregnant. So you should be touching the antenatal care, postpartum care, and the postpartum care as well. Okay. So in this situation, keep on checking understanding in between. All right. Okay. Yes. These type of words, right? Give her the written patient information leaflet and thank you for seeing me today. All right. This is how you end it up. This is how you complete. If you go to your templates, I will show you the library that how you have to analyze and assess, right? In now starting the preparation, you people have to understand that the first thing is that you people have to gather up the entire curriculum. All of you, please write in your study groups and ask for the syllabus and ask about preparation folder. 83, 84, both of you, please. 82 already have. Yes, they already have started. Please write down in the group that can we have the syllabus and can we have the preparation folder. Just write this and you will get that all from the moderator. Okay. Then you should be preparing yourself module wise because 14 stations, one from each module generally. So you complete early pregnancy, your one station of exam is done. Thank you, Aisha. Now you have to make the right schedule for yourself because there should be at least 3 revisions. All the exam tested stations should be on your tips. But with that, you people have to understand that we have to cover up, we should have the ability to cover up all the new stations also. In each exam, there can be like 1, 2, and in the May exam, we had even 3 to 4 stations in one day, the newer ones. Do you all understand this point? Yes? Did you guys subscribe to the channel for the books, everyone? Do you have got Lisa Joel? Have you got Oxford? Have you got Tony, The Get Through, and Justin Kunjay? Everyone? Yes? Have you downloaded all the books? Yes? Because I will tell you specifically. That's perfect. Rahat, if you've not done, please, in your group is the link. And please do that. Yes, Oma. All these books, put in your good notes, and we'll start making and highlighting the things. I'll specifically tell you what you have to do from these books. Okay? In your library, I will give you all the solve templates which are required, and they're sufficient. Thank you, Pranita, my dear. Okay? So the books are solved, and certain audios are also there from the books. So nothing is a difficulty. Everything is going to be in platter. But what we need is that we need to understand that we have to take a start module wise. Okay. Rahat, write in the group, please. The moderator is going to tag you. Okay. Write in the group, my dear. She'll tag you in the channel. So for each module, we generally get 1 station. But at times, yeah, sure, my dear Srija, I just got your registration, I think 1 or 2 hours back. I'm going to guide you everything in the group. I've added you in the group, sweetheart. Just write your queries in the group. Everything is going to be answered in 84th batch, my dearest. Thank you very much, my dearest. I got your registration. Actually, the other students are the older RFA party students, my dear. That's why they're being a little faster. So you don't worry, please. After this introduction, anything which is missing, just write in the study group and the moderators are going to be there. Don't worry at all. Okay? Yes? Thank you so much, Uma. Thank you. All right. So actually, the newcomers are joining from outside, Uma. So Aditi, yes, my dearest, happy to have you in the RFA family. You'll find all of them so much like a togetherness, and you would feel a very strong bonding here. So don't worry at all. Okay? Just write the queries in the study group and the moderator would answer and everything's going to be with you guys. Okay? Thank you, Uma. Help your newcomers, please. Thank you. Okay. So this is how the stations are module wise. Okay? Teaching, co-surgical skills, post-operative care, antenatal care, maternal medicine, management of labor, then management of delivery. We've got postpartum problems, one station, gynecological problems, fertility, sexual and reproductive health, early pregnancy care, gynecological oncology, urogynecology, and pelvic floor problems. Now, all my syllabus that contains all the stations, each module-wise curriculum that's there. Okay, so you people are going to just write it down what stations are to be there. And then we've got the preparation folder in which the repeated stations and the new stations all are given there, the expected stations and the older station. Everything is there. So you should be knowing that this is the content for each module. Okay, so we are starting with maternal medicine next Sunday. However, there can be a little overlapping as well. For example, in my exam, I had two teaching stations. I had a bullying station of teaching, and I had another station of molar pregnancy, teaching to a junior, which was the operation theater notes, right? So that means what? That means that teaching was overlapping with early pregnancy. At times, it can be overlapping also, but the general outline is that one station, one module. Am I clear? Could I make myself clear? Yes? This is how the outline of the module, 14 stations, 14 modules, and we will prepare module wise in the regular session. From the very start, because see, the problem is not that we can't prepare. The problem is that we have to have a very good revision in the end. For that, I always suggest folders. Make your teaching folder, early pregnancy folder, your gynecology folder, urogyne folder, oncology folder, so that in the end you can just have a very good, quick revision of and scanning your templates in the end. Okay. If you have time, you can write it down, the templates. If you don't have time, just take the picture from the website templates and just keep it, take a printout and keep it with you. It depends upon you're taking the May exam. If you want to write it yourself, do it, my dear. After my session, write the lines on that, same as we did in Mrcog Part 2. Okay. Otherwise, you can take the templates from the website. The website is completely having all the templates. All the stations are sold on the website. You just need to revise them and learn them. And certain things we keep on adding them when we do the live session, right? The right schedule, which we are going to make for you guys, would be sufficient. But there's one humble request from the very start. We're going to start from maternal medicine. You will have the next one session, the next to it, the next to it. When you reach to third and fourth session, you have to promise me that yourself, you will give 1 to 2 hours to the first one. After 3 to 4 modules, please start your revision from the first, second, third from the website. Please do that. The problem is when you reach to the 14th module, you don't remember what was in the first, second, third, fourth, and you're blank. What I want you to do is, which is my way of studying, that you have to go, I would just make it for you guys. You have to go with the modules. When you reach to the third and the fourth, please start second go the same. When this one reaches here, please start the third go. When you reach to the 8th one, you should definitely start again this. Do you guys understand, please? Because we've got very less time. This is for the November students, please. I'm not talking to the May students for this. For May student, don't worry. We'll complete one round complete, and then you'll have a revision schedule, right? But for the November students, you have to start your revision when you reach to the third module. Please start revising the first module. Give your 1 hour to the first module also. And in your mini groups, we'll make sure that you guys do that. Am I clear? E, that's my girl. Very well done. Right? Umma, when you have 14 modules, right? You're going to start with 40 modules, okay? So when you reach to the third module, you will have fourth module in your first go, and you will start your first module revision in the second go. Do you understand this? This is what you have to do in your mini groups. And I will tell you in your mini groups that please start revising. For example, 1 hour meet of maternal medicine and 2 hours meet of the new session which you're going to have. So start revising the older ones. Aisha, do you get my point, please? Because you guys have made you guys the group leaders. Okay. So in the mini group, you people, exactly, yes, Uma. This is the way that we can ace it. You know, I prepared in 45 days. When I prepared in 45 days, in that time period, what I did was I was doing the new things and I was revising the older things. So there was a time when my older things got like 3 times revised. I always tell you, even in part 2, I told you guys, that we have to be organized. It's not about MRCOG, it's being organized in your studies. Have to be good and perfect for you have to train your minds. All right. I would come to it for as per the times in terms of November and May, how you have to do that. Okay. So time management is very important. And in the second go, I have to make it sure that all the important exam stations are done 100%. There should not be any confusion in any missing station if it's a repeated topic. But yes, we should have a capability if 1 or 2 stations are new, we should be the best in those stations also. When we will have the third revision, in one day, you people have to do 14 stations. And Aisha, how would you do that? You people will have your buddies, you will do the Zoom, you will stick 14 stations on the wall, take the printouts on the wall, and you people will do back-to-back 14 stations. Why? Because I want stamina building. I want that there's no exhaustion. You have a focus till the last 3-4 stations, you're not tired. And you have to test your limits before you reach to the circuit. We will do all the mock exams, and you people have to, after your booking, I'll book you guys for the mock exams. We will have the mock exams on all the venues, right? So you people will book one mock exam before the real exam. I would definitely suggest that. And that would be done once you book your seat. Then accordingly, you have to discuss with me that which venue mock exam you're going to take. Is that clear? Right? Okay. So everywhere in each venues, it would be there. But then you have to tell that where you have booked the exam, and accordingly, we are going to book you for the mock. And then you people would do the mock booking. Maybe you people require some traveling or something, but it's absolutely okay because that would give you the real rehearsal of the exam. All right. Because for part 3, reaching and passing through those 14 back to back, that tells you. And my suggestion always is, which I'm going to do, I'm talking to the team also. We are all making the schedules and the plans for this. So it's going to be at least 15 days earlier to the real exam so that you can work on your mistakes. All right. Do you guys understand, please? Okay. At least 15 days before the exam. So that now, so what should be our aim? I'm talking to the November students here. Your aim should be that 15 days before your exam, your preparation should be over. Right? It should be over. Oma, you'll get seat not in Saudi, right? You'll definitely get seat maybe in India, or you'll get seat in UAE, right? Yeah. So just message me, I'll tell you. Okay. Yes. Okay. All of you, please pay attention. Yes, absolutely. Both the venues, it would be there. Okay. Everyone, please pay attention here. Now you have to remember, yes, Rahat, yes, my dear. So all of you, please pay attention here. You all have to make your schedule with the sessions. Like I'm going to end up with you guys somewhere in the beginning of the October. I'm talking about the November participants. So 14th of October is your deadline for completing your completion of the curriculum and the last moment. Why? The mock is not your mock. You have to be ready that mock is your exam. That is your real exam. Do you all understand this point? That is your real exam. So that should be your assessment day. because after that, Deepak, we would work on the things which are needed to be like polishing, and the final things which are left. The students, they make a mistake, Pranita, that they attempt the mock like, okay, it's fine. If few things are missing, we'll just cover it up and we'll just complete it later. This is not the right thing to do. This is not the right approach. I always tell students that you have to take a mock as if this is your exam. The complete stress of the exam you have to take before the mock. Do you all understand this point? And that is the only way that the next 15 days you people can actually polish yourself. Right? All would be there on site, online, all would be there, Sheetal. Yeah, but because they are not having an online exam, whosoever can travel, that would be perfect. But if somebody cannot travel, they can take online also. Okay. All right, Sheetal. Depending upon that day, you can reach out to the venue. That's perfect. But if you can't reach out to the venue, then you can take online also. Both availabilities would be there. Okay. Now, how to decide depending on the time? I need 6 to 8 hours. I need 6 to 8 hours for the November attempt. If you can give that, go for the November attempt. If not, then go for the May. Required 6 to 8 hours, Pallavi. Yes, so from now, it's like 4 to 5 hours. Yes. Yes? No, in the end. Pranita, from now, I need 4 to 5 hours. Okay, yes, the countdown begins, Sheetal. As a happy family, I told you guys that the ones who did just in one go, right? You people have to be one of them. Yes. And the ones who have got the commitment, like who are busy, who have difficulty, who have some family commitments, they can take the May batch. May batch is also starting now. August, 4 to 5 hours. September, 6 to 7 hours. October, 8 to 9 hours. Got it? Got it? This is what I suggest, and this is how we have to do that. All right? You've got all the patient information, you've got all the data. Everything is in the platter. And I'm also making your ebook same as that of the part 2. You guys remember your ebook? And if I'll make that, you people would love it. And just it's on the completion. Everything is like with the index. You just have to learn that ebook and your templates are there. You people would love that because everything is organized in my ebook, right? Definitely, yes, my dear Pranita. They do that depending upon the background. That's what I told Rashida. That's what I told. If you can just write it down yourself, the template, you people would do that. But if you can't do that, then you people can just take the pictures of the templates and just take a printout and solve it. That's it. Okay. All right. So all the batches are starting. Again, I'm making an announcement here. The November 2023 and the May 2024, both the batches are starting. The only thing is that the pace would be slow for the May because there are long-term batches. So I won't be very fast, but in November, we have to be fast. All right, that's the only thing. No expression of interest, Sheetal. You're going to get an email. All the passing students are going to get an email for the registration, and the dates are already there. MRCT Part 3 dates, Wednesday, 1st of November, Hong Kong face-to-face. All my Malaysians and the Myanmar students, they're planning for Hong Kong. 1st and 2nd November, United Arab Emirates, Kolkata, India. Again, a face-to-face exam. 6th to 7th November is United Kingdom, Egypt, Mumbai, India, face-to-face. 13th to 17th of May is basically 11th to 15th of May, 2024. So basically the May students, please note down, this is your dates, 13 to 17. Okay. All right. That's perfect, Sheetal, my dear. Everybody, please note it down. Okay, no problem, my dear Srija. Just after the session, just drop in a message. I'm here with the pictures though, Srija. I'm here with the pictures, yeah? All of you, please. So basically, they're going to give all the details. I hope you people have your addresses. The way you want to take the exam, the address should be the same. I hope the assessment of training is already done for you guys. And the priority booking, the emails would be received 24th of August, 2023. And the booking window would close Monday, 28th of August. Again, booking should be on the first day. Please be clear. I will send you all the booking guidelines and everything. In the study groups, we are going to help you guys that how you people have to be faster in booking because that's something, again, students define difficulty in, right? So Am I clear about the information gathering, everyone? I have to make it very, very clear that information gathering is so important because you're starting up this station and your confidence is all about information gathering. So when you start your information gathering, you should have your template in your mind. So today, if you go to the website, everybody open up the website, please. Log into the website in the OSCE templates, right? Yeah, sure, no worries at all. So everyone, please log into the website. Done? Yeah? Okay. So when you log into the website, there are OSCE templates. And in the OSCE templates, you go to the information gathering, history templates. In the history templates, you've got all the module-wise history taking. All 14 modules history taking is there, which you have to learn side by side with the time management. Am I clear? Did you guys see the information gathering in all the history templates there? Everyone, did you guys get the history templates on the website? Innocent Rafa, my dear, booking windows would be 2. Yes. Yes. All right. So all of you have to do all the module-wise history information gathering. Oma, log into the website and go to the OSCE templates. Log into the website and go to the OSCE templates. And in the OSCE templates, go to the history folder. Thank you very much. History taking. Okay. What I'll tell the website team to put the picture for you, because there you will take the history of information gathering of everything. Thank you very much. Neha, got it? Yes, yes. History templates. Yes. Got it? They'll share the pictures so that you can go through that. And everyone has to be very, very clear. Okay. Thank you very much.
नहीं रुको मंजे दे दो मैं हैंड
Hello, Neha. Okay. All right, everyone. Any question about the information gathering which is not clear? I hope you people are clear, because this domain from the start should be your at your best, and it should be very skillful so that you exactly know that how you have to start up. All the information gathering is there. Pranita, it's just on your website. If it's not there, please let me know so that nothing is a confusion. Okay. All right. Okay. All right, please, all of you, please, let's understand that what's going to be in the library and how you have to access the library in this. If any question is there, anything is missing, you people can definitely go. Let me know if any concern is there. All right. Okay. So always try to summarize your history if the time permits. That Anne, you're 24 years and you're here today because you're pregnant and you don't have any complaints regarding this. If she has any positive history, always give that positive history in the end. Okay. And if at all the patient is having some sort of a problem and a concern, you go to the website specifically. For example, A negative blood group, O negative blood group in early pregnancy, information gathering is given on the website, and you should be so clear on this. Every single history is given as per your modules in your website, and you have to learn with the modules. For example, now maternal medicine history taking, from today, you guys are going to start. All right, from today, you're going to start. Now, the basic thing is that students, they make certain mistakes, which I have to clarify. They apply all the standard template to everything. Where they go wrong, you have to listen to the role player and mold yourself. There's no standard template. We learn the questions, but maybe, Uma, your patient is gravid at 3. So you have to take the past obstetric history. If she's a primary gravida, you would not take. Aisha, do you understand? Maybe she has a previous abortion. So you would definitely ask that how was that dealt with? Was it a surgery? Was it a medical management? And if she doesn't have a previous pregnancy or an abortion, of course, you're going to leave it. Similarly, you people have to understand, she might answer you that, yes, I'm a smoker. So you have to get her connected to the smoking cessation program. She might say, no, I do not smoke, but she might say, yes, I take alcohol. So the answers would change your template and you individualize. Do you all understand this point? Yes? So you all have to understand that we have a standard template, but we have to apply that on the answers of the patient. Please do not take irrelevant history. That takes too much time. And information gathering has to be relevant history only, the focused history. Do not ask questions which are not relevant. And when we will practice, I will specifically tell you that how to stay into the focused line in the history taking. I want you all to complete your history taking 3 to 4 minutes, not more than that. Okay? 3 to 4 minutes and not more than that. Right? Because after that, if you're taking more time, 3 to 4 minutes, then you're using the time of your applied clinical knowledge. Right? Now comes the question, how we have to save time in information gathering. We have to save time in information gathering by being organized to the questions and not starting merging it with the management plan. For example, she has got BMI of 42 and you start telling, all right, so because this weight to height ratio is towards the higher side, this can have certain implications on your health condition for you and for your baby. So we are concerned about this and we will do the management about this. This line is not required in the history taking because students, they make a mistake. They start doing the management within the information gathering, and information gathering goes to 6.5, 7 minutes, and then they don't have time for addressing the concerns and doing the treatment of the patient. Do you all understand? You have to be so careful in information gathering. Complete the information gathering, and then once you do the management, because it's domain-wise score, when you come to the management, then please deal with the management properly. Do not merge it with your management, because then you lose your score in terms of losing the questions. You lose the focus of the information gathering. Could I make myself clear? Complete the information gathering and come to the treatment plan, right? And if you're missing out at something, definitely yes. The role player gives you a hint, Umma. Pranita, but we don't pick that up. You know why? The biggest mistake with students they do is that they have a template in their mind, and while having that template in their mind, they think about, they're asking one question, Aisha Jalil, and they would think about that, oh, what do we have to ask next? They do not put an attention to the answer which they are being given by the role player. This is the biggest mistake. I will give you one example, because here you people will find me very, very strict. This is your history template in your mind. You ask a question, may I know your name and age? She says, I am Anne, 32 years. So you have to say, all right, is it okay that I call you Anne? So you have to listen to what she's saying, right? So ask an open question. The first question has to be an open question. How can I help you today? Or I've gathered that you're here because you've got heavy periods. Can you tell me more about your periods? When you say that more about your periods, you start thinking, this is students' perspective, you know? They start thinking, okay, about periods, now I have to quantify, I have to ask if she take any medicine, if she's having some sort of a fainting, and since when is this happening? All this you are thinking. What she is answering for the HMB, you do not listen to it. You start thinking about the next question. Now, she might answer so many questions which you are about to ask. She might say, yes, doctor, I've got heavy periods and they happen like every 10 days, in 30 days, and I have clots passing and I'm flooding, and I'm so worried about this. I took some medicines from GP. There was some pain relief, but it didn't work for me. You don't listen to all this and you say, okay, did you take any medicine? Such a common mistake that students, they start asking the same question which she has told. And immediately the examiner realizes that this candidate is nervous. Do you all get this point? So the first step which I have to give, and I will be so strict on this, is please listen to your role player. Please listen to your role player because she has got instructions. Role player has got a sheet in front of her. Some highlighted points are there. She has to tell you those points. She guides you. She navigates you towards the scorecard. Am I clear? So please understand that whatever she has told, you don't have to repeat that again. You don't have to repeat those points again because she's giving you a hint. When we will practice, you will understand that really well. Okay? So any questions regarding the information gathering, please? Every single station, information gathering makes you pass because it's the first 3 to 4 minutes of your station. And believe me, when your information gathering is confident, you are confident throughout the station because that's just the start. Yes? Okay, perfect. All right. So all of you, please utilize your library very smartly. You've got all the Green Top guidelines summaries on your portal. You've got all the flashcards on your portal. You've got all the miscellaneous RCOG topics. You've got all the nice recommendations of the summaries on your portal. This is how it looks like. You've got all the book staff index, which tells you that which topic is in which book. All the newcomers, please. Srija, my dear. Archana. Apita, please. Everybody, please pay attention. Then you have got all the templates of your module wise. So for now, first you will do all the book staff index. You will see that what are the book staffs available. Then you will go to the maternal medicine because you guys are starting maternal medicine. Okay, so you will read the maternal medicine templates here. Yes, and this is your 1 week. Do you guys understand? Now, when you go to the miscellaneous OSCE, yeah, here you will get also some combined recall stations. When you go to the OSCE history templates, this is what I was talking about. Everyone, Umma, here, you will get 14 history templates where you will do the maternal medicine for now because we are going module-wise, right? They are books index-wise, books index. Right? Many of the books are module-wise as well, Umma. Like Lisa Joel has got on one maternal medicine station. Do you guys understand this, please, everyone? Everyone, please, understood this point? Okay. So Aisha, book would be done like maternal medicine templates you will do from here. Then you will go to the book stats and see all the maternal medicine topics because index is there. You take the printout of the index, Aisha, and you see the maternal medicine topics of the books. Just scan them from there. That's it. Right, everyone? The first step is do the history of maternal medicine, then go to the maternal medicine templates, all these topics. These are all the recall stations in the important exam tested. Once these are all the topics which you have to cover, you do its GTG recommendation, the NICE recommendations, just revise the TOG recommendations according to the article. Then you go to the books and see the index and book solve stations just there, do them module wise, like maternal medicine books should also be solved. So that 1 week, 1 module is completed completely. All right. Yes, Pranita, the same books. Pranita, 5 books. Lisa Joel, Kunjay, Tony, Oxford, and get through. 5 books. Pranita, got it? Those 5 books which are in the channel. All the index we have made here so that you don't find, because books are without index. You will find it on page number, this is maternal medicine, this. You won't find a difficulty in searching. Very good. Guideline, do side by side. Uma, everyone please pay attention. Do not do the guidelines separately. For example, today you guys are doing obesity, right? As the maternal medicine station. So if you're doing obesity today, open the GTG obesity recommendations, open the patient information leaflet of obesity from the PIL group, open the obesity template from here, and then revise. Got it? This is the pattern. Aisha, do you get that? Just scan the topics with your template and topic. Do not do it separately, maternal medicine, GTGs. You don't have to do it that way, please. Topic-wise. I repeat once again, everyone. Your topic is Graves' disease today. So Graves' disease is an important exam tested station. You will go to the patient information leaflet Telegram group, Telegram channel. You will search Graves' disease channel from there, and every day moderator would also post for you. You will read the Graves' disease PIL from the channel, RFA channel. You will open the Graves' disease template from here, maternal medicine here, and you will learn that. You will do the Graves' disease recommendation from the talk article thyroid, because we've got only that talk article for this, right? And you will see that if at all in the index we have Graves' disease, we don't have generally in the books, we don't have. You can write also daily in the study group, the moderator would tell you that this station you will find here. All right. So this is in 2 hours, your Graves' disease would be completed. Got it? Not at all, Pranita. No stats, no percentages. Generally, the patient might ask you one question: how much is the chance that I get this? How much is the chance that I get that? But that is from the patient information leaflet. The most important thing for your preparation is PIL, because the patient information leaflet gives you the exact content which you have to tell to the patient. All right. Uma, this is as per the schedule that would be given to you. All right. At least 3 stations you should be preparing for now. Right? 3 stations. Okay. Got it? And complete 1 week schedule she would be giving you. All right. This is what you have to cover. Got it, everyone? Yes? All right. That's perfect. Thank you. So you've got all the recent talk article summaries also. And that's including the 2023 talk articles, which I expect definitely to come. All of you, please, sickle cell disease is a new green top guideline. 100% sickle cell disease would be coming up. All the recent talk articles are very, very important. We get the recent talk articles as per the discussion very frequently. All right, that again is very important. Absolutely no problem, Pranita. It's just 1 week or 2 weeks time, and everything is going to be after first session. Everything is going to be fine. Yeah, one more thing, please. Do you wish to understand the pattern? For example, let me see the schedule, because this complete week I've got part 3. So tomorrow is 77 and 78 maternal medicine. Do you wish to attend? 77 and 78 maternal medicine is tomorrow. Do you guys want to attend? Yeah. Okay. And day after tomorrow is 79 and 80 is on Tuesday, right? So I've got daily, I've got maternal medicine of all the batches. So you people can, their session is tomorrow. I will check in the study group, yeah? We'll let you know. Okay. So daily I have part 3 sessions of this week is complete maternal medicine, everyone. Complete maternal medicine week is this. So they will present. 77 and 78 session is there, Uma. They will have the presenters. They are presenters, of course, right? Like you will have your maternal medicine on next Sunday. So you guys would present. This complete week is my maternal medicine week. So 77, 78, 79, 80, 81, 82, 83, all are there, and they have their own. Everybody has got their own schedule, but the active participants are different, Uma. All right. So tomorrow is, yeah, sure. No worries. I'll just tell you the time after 30 minutes after checking their study group. Okay. Right. Sheetal, it depends upon how many presenters are available and how it goes. They are a senior batch because they are ending to their session. So they are good. The feedback would be a little faster. For you guys would take more time. 3 to 4 hours generally. Okay. 3 to 4 hours. All right. So tomorrow you all can attend, or day after tomorrow, Monday, Tuesday, both are maternal medicine days for 77, 78, 79, and 80. So you people can attend those sessions. Not a problem. Would that be okay? Yeah. So that would be just tell you guys that how the things are. Okay, perfect. Amazing. Thank you so much. Can we get the timings of the session in the group? Uma, I will post in the group, my dear. Yes, I will post in the group. No worries at all. No, my dear, it's not like that. May already, I think 8 registrations have already been done. Galaxy, already people have registered for May. Yes, already. Ria is also for May. Yeah, lots of people have joined the May batch. May batch, I'll be starting. I'm getting lots of queries. So I'm going to start the May batch in 2 weeks' time. Yes, we'll give you the schedule. Absolutely, Aditi. We are going to have the recording of every session. Whatever I'm speaking would be on the record, and you're going to get that. Absolutely, my dear. Yes, Sheetal. Yes. Thank you very much. All those who are for May batch, please, I'm going to start the first batch, long batch, in 2 weeks' time because I've got already half-filled batches there. And we're going to start that. As soon as you join in 60 minutes of registration, you got all the portal access, and it's going to be easy for you guys and everything's going to be simple. Okay? Any questions, any concerns, anything for reaching out to success? I'm going to be 100% working hard for you guys, but I need 200% from you, your side. You all know it, that how RFA works. You all know that how the moderators are going to be there. You people would not find it difficult, but yes, I just need from the very start that you are in the right direction and there's no confusion. Any question, please? So what will we do in the next session? You're in the 83rd batch, my dear? Are you in the 83rd batch? Because I can't see your name. Yes, Aisha, you can unmute, my dear. You are in the 83rd batch, my dear. Hello. Thank you so much. Are you in 83rd batch?
Hello, ma'am.
Hello. Yes, my dear Aisha.
Ma'am, I wanted to ask you something. Ma'am, the topics which were shared by a moderator in our group for maternal medicine, they are 8 in number. And I was going through your schedule syllabus, which was given in an open group. And there are 47 topics in maternal medicine. So, ma'am, how we will cover those topics? Most of them are, I think, in books as well.
Yeah, book topic. The 48 topics of maternal medicine, they are generally overlapping with antenatal care also. Because
Okay,
maternal medicine and antenatal care are pregnancy topics, they overlap, you know. So those topics first prioritize yourself. The 8 topics are those topics which are the exam stations, which the moderator has given you, which I'm going to do in the live session. Do them perfectly. And make your outline, for example, for each station, make a small bullet points that, okay, if, for example, any heart station comes, what would be the points? What would be the information gathering? What would be the applied clinical knowledge? What are those common points? For example, intrapartum, postpartum ergometrine is not to be given, you know, intrapartum fluid overload should not be there. Get my point? So these type of common things we have to do so that we get organized in each. So those you have to do side by side yourself from the book, and I will tell her to cover it up and tell you that the schedule should contain those which are the exam tested stations and those which are from books also. Everything is from the books. Okay. Yes, Oma, every session, 8 students will present. Yes, Oma. Okay. Yes. Any other question, please? Okay. 84th batch, your few seats are available still. So I think today students would be booking. So you will attend the next Sunday with them. Please start your maternal medicine also. The moderator will be guiding you in your group. Okay. Yes. Any other question, please? Yes. Any other question? Yes, my dear.
Hello, ma'am. Hello. Thank you so
Hi,
much for a wonderful session.
Thank you, my dearest. Yes, Rashida.
I want to ask that how we will discuss with the study buddies. Hello.
Yes, Rashida. It would be in the mini.
Can you hear me?
In the mini group, my dear. Rashida, you are in 84th?
Hello.
Yes, I can hear you, sweetheart. You're in 84th or 83rd?
I am 83. I am 83.
So you're in the mini group, right? ABC? You're in your mini group practice group, right?
Yes, I am in mini group B.
So in B group, you will be discussing and you people will be meeting up.
Okay, we have to pair with the single participant or we can pair with
together.
3 or 4.
Safa will guide. Together you can have a Zoom meeting, and yes, Zoom meeting 3 to 4. Whosoever is available, set a time today and start discussing.
Ma'am, may I ask
we have to set time with Safa?
Yeah, no. Individually, what suits you guys in the mini group? What time suits you guys as students? What is a suitable time for everyone to meet?
Okay, thank you so much. Thank you.
Thank you, my dear Rashta. Thank you, Sheetal. Yes, my dear Rest.
Yeah. Ma'am, I just wanted to clarify this, that when we are working weekly, definitely we won't be able to cover all the stations, but obvious. But the new stations that you talked, ma'am, so all the new stations, in case they come as from talks and GTGs, right? So our small notes that we have from part 2, if we just read out that, we'll have some idea to work on that station, right?
Absolutely. Applied clinical knowledge would be fine. And general speaking of the station, you'll get to understand from like how you have to carry yourself in a station, how you have to introduce, you'll otherwise learn, right?
Okay, ma'am. Got it. Thank you, ma'am.
Thank you, Sheetal, my sweetheart. Thank you very much. So just the active participants, they present. The listeners, they do not present. They just are passive. They just listen to others. However, whenever you're busy, I always tell the students to come to the active participation because active participation gives you a little right direction that where you guys are missing and where you have to be better. If at all you're not available, students, they generally tell that, ma'am, this time we are not available. So I tell them that we just come for 10 minutes. Like, for example, in the start of the session, in the middle, or in the end, whenever you want to present, just give me a message that, ma'am, I would be presenting first, I would be presenting last, because I have my commitment. And then you can leave the session, because so many sessions of that module is being done. You can attend any live session, but your presentation would be in your session for 10 minutes only. Give me 10 minutes only, and then you can attend any live session. The recording would be uploaded. Got it, my dear? Just 10 minutes, do your presentation. Okay? Thank
Excuse
you.
me, ma'am.
Yeah, Sheetal. Yes, my dear. Sorry, yes, Uma.
Yeah, ma'am. In one session, how many presenters would be there? 6 or 7?
8, I told you. 8.
8 presenters
Yes.
will be presenting in one session.
Yeah, all the schedule of the presenting
Schedule is there.
names would be scheduled already, Uma. As per schedule, you
Okay,
will
ma'am.
present. The schedule is posted already, sweetie. So, for example, if you're A1, A2, so you know that where A1 is presenting, okay? It's going to be like that. Okay?
Ma'am, structured discussion is like a viva, like we used to have in a PG
Absolutely.
exam. So
Yeah,
we need a
same as
concrete theory for that. Okay,
Yes,
got it,
yes.
ma'am.
And you will talk, like, for example, the Green Top guideline says this, the NICE guideline says this. It's an examiner discussion. Recommendations and all, like a viva. Okay? Okay, all of you, please, 83rd batch, write in the group. Are you having a consensus for this time? Sundays I've kept for you guys. This time is okay? So I can keep
No,
the second.
ma'am. Sunday is working, ma'am, for us.
Okay, then what time is okay for you guys on Sunday?
Ma'am, any time after like 1 p.m. GMT, because that would be after the working time for us.
Okay, 1 p.m. GMT. All right, then 4 p.m. GMT, Malaysia would be very late. Aisha, delete. 4 p.m. would be what time for you? Yeah, I've kept Sunday for 83rd though. Daytime. 12 a.m. midnight. Okay. Yes, on Sunday, okay, but if working day is evening. Yes, on Sunday, okay, but if working day is evening. Okay. Okay, let me check. Okay. Let me find the timings and let you know, guys. Okay. All right. No worries. No worries, no worries. Yes, I understand, Aisha. I'll take care of that. After 1 p.m. GMT, Umma, you guys would be home. Saudi, huh? Yes, Srividya, I'll keep Sundays for you guys. Yeah. Okay. All right, that's perfect. Okay. I'll just fix out the time for the maternal medicine and post the timings for you guys. All right. 1 p.m. Deepak. Okay. That's fine. I'll just see the other schedule and we'll post the time accordingly. All right, my dear.
Just one more
Yes, my
thing.
dear.
Like in part 2, you guided
Yes,
us
Uma.
like prepare the notes, and also here how we need to organize our like one module. What all we need to
For
collect in the
example, what
podcast.
is today's topic? For example, today's topic is what is the topic in the schedule? Did Ritu give you guys? Anything in maternal medicine, any topic, for example, it's a pulmonary hypertension. Sorry?
Graves' disease was the first topic given.
Okay, it's a Graves' disease. So you will write Graves' disease on the top. It will be in your maternal medicine folder, right? So you will have a you have a template
Yes.
on the website. You can write it down, that template,
Okay, ma'am.
or you can just simply take a picture and put it on your folder, right? And moreover, what you can do in that situation is that you go through the patient information leaflet and write the
Summary
important
notes or
on complete
Yes.
notes, patient information leaflet on this. Your Graves' disease is done. And then you
Okay,
practice,
ma'am.
speak in
Okay.
front of the mirror for 10 minutes and speak with your buddy in your mini group that I've prepared Graves' disease. One will become the role player and the other will become the presenter. Okay, so it's similarly like this. All your sheets should be ready. All those who are using the good notes, you just put it on your good notes, just copy paste and put on your good notes, and then just start revising from there.
Ma'am, the role players, questions and all, how do we prepare? Like, suppose my friend is
It's
presenting.
not the same, Uma. It's not the same. No. It's not the same. You can do anything. You can be a smoker. You cannot be a smoker. In exam, it's anything.
That you can decide, like, as a role player, we can.
Yes, you can decide that how you have to give a tough time. You can say, I'm taking propylthyrosol, you want to leave it, give like these type of conditions so that the other person starts speaking and understand. Tomorrow, when you'll attend the maternal medicine, you people will understand. You'll see different phases of mine. Okay? All
Yes,
right?
sir. Yes, sir.
Okay, thank you very much. Thank you, my dear. Aisha, you want to say something?
Yes, ma'am. Daily we will prepare a topic and then we will put our audio in the mini group. This is how we will
No,
prepare.
why don't you guys meet live? Like 81st batch, beautifully they're meeting. They do a Zoom meeting and they meet together and they study together. They do Google Meet. In the mini group, you do Google Meet, you do Zoom, anything you people can do.
Okay, ma'am. And with a study buddy, ma'am, it's like also like this, that one will prepare, one will present, other will listen. Like this.
Exactly. One will present and then others give the feedback, okay, the here we can be better. And then you quickly in 5-10 minutes, you just revise the applied clinical knowledge of that. This we'll say, this we'll save, this has to be given, right? And any queries there, put in there that we met today. And ma'am, these were the queries which we had. So immediately that query, we'll say, okay, this is your today's problem which you were facing. So in 2 to 3 meetups, you people would be perfect.
Okay, ma'am.
Got it? Okay.
Okay, thank you.
Thank you, ma'am. Today, just tag me there if any concern is there. For 1 week, you need complete supervision and then you will be in the flow with the live sessions. All right? Okay,
hello, ma'am. Hello.
Yes, Rashida, my dearest.
Yes, ma'am, I want to ask about fast track also. We have to attend on that also, or is this
totally
course
your
is only
choice, but generally you people have so much off around, I think 70%. So regular students, so you people don't have to worry. Actually, in fast track, I do all the recent stations. It's very fast. Let's start with the regular, and then I will tell you guys in the regular that how you have to take a benefit from the fast track. Okay? Because the fast track are all the recent exam stations. Yeah. Okay?
Okay,
so we'll
okay.
Thank you.
You said you will tell us about the exam places.
Exam what?
The exam destinations, like what we have to ask.
I did tell you. Uma, for you, there are 2 options, right? Mumbai or UAE, correct?
Yes, ma'am.
Both are fine, my dear. Both are.
Okay.
Yeah, both are. Yeah, both are fine. See your ease of traveling, and both where you can just have the mocks as well, no problem.
And ma'am, where the results are better?
Actually, last time for Egypt, we had a wonderful result. I think almost 90% and above. And but many students they can't just approach. And Hong Kong, Singapore is always better. UK has always been tough. For India, there are certain centers. Chennai had been tough, but Mumbai comparatively was better than Kolkata. But again, I always say one thing, that you have to be best if in that center, when Chennai had the worst result, my student got gold medal in Chennai. So, and in the same result, when it was the worst result in Chennai, students were failing so much, but she got a gold medal. So I always tell, and she just remembered one thing. She said, "Ma'am, I just remembered one thing, that if one has to pass in that center, that has to be you." So if you prepare with this aim, that if everybody has to fail in that center, and Aisha, if only one has to pass, that has to be you guys. If you prepare this way, Umma, you have to be best in your circuit. Simple. Do you all understand? Yes, UAE is fine, my dear Aisha. That's fine. Inshallah. Right? So this is the aim which you people have to keep from this point onwards. And the same enthusiasm, the same zeal and zest, togetherness, queries and the questions would come up in the very beginning of the preparation. That's absolutely understandable. We are all here 24/7 for you guys. From the start, ask wherever you're stuck up. Because in this 1 week, I have to transform you guys into a perfect preparation schedule. Once you will understand that, you will be perfectly will be going like 77, 78, 79. They're perfectly doing their practices. They know what they have to do daily. Daily, we are getting the mini schedule, mini groups, Google Meets and WhatsApp, and they're studying and they're practicing together because they've got the hang of it. You people will take a little time, but I'm sure in this 1 week, you people have to understand the gist of it. Okay? Yes, Pallavi, my dear. I'm happy to listen to you. Yes, my dear.
Good morning, ma'am. Ma'am, I
Good
just
morning,
wanted to
sweetie.
ask you, will be getting PDF of template of modules, or we have to take screenshots from the website?
Pallavi, unfortunately, no PDFs, but you can
No
take the
PDF.
picture. No worries.
Oh,
Okay?
thank you. Thank you, ma'am.
Thank you, love. Thank you so much. Thank you. All
Hello,
right. Any
ma'am.
other questions? Kazi, hello. How are
Hi, ma'am.
you?
How are you? Yeah.
I'm fine, sweetheart. Yes, my dear Kazi.
Yeah, ma'am, just one question. So actually
Sure, my dear.
some of the stations are so big that in the information gathering, sometimes you cannot finish within 4 minutes.
Yeah.
So should we always take the history of like social history, how is support at home, mental history like that in the every station, or if the
Kazi,
station is very big,
Kazi, as
yeah.
I told that, we have a general template, but then we have to individualize. I want you
Yeah.
to be very smart in exam. If you feel that you've already crossed 4 minutes and now the applied clinical knowledge is too much,
Yeah.
I would filter. Then I would skip because I would wait that I have taken the 80% of the information gathering. If speaking unnecessary questions or asking about her mental history and she's happy, cheerful in front of me, skip that question. So this is what we have to decide on the exam day or at that very moment in practice. That if
Yeah.
I'm
Yeah.
already at 4 minutes, I would be thinking if I'm already at 4 minutes and I've got lots to cover in the applied clinical knowledge and the patient's concern, take mental history. I would not ask about the mental health because I feel that, okay, I'm talking to her, she's absolutely fine. So I just move further. Do you get that? So it is how you weigh during your station, my dear. Okay?
Yeah. And if the occupation is not very much related to the station,
You can
that
skip
one
it.
also
If you have a
yeah, yeah, yeah.
concern for time management, skip it. If no concern for time management, ask it.
Okay,
Okay?
ma'am. Okay, thank you. Yes, ma'am. Thank you.
Thank you, love. Thank you very much. Thank you. All right, guys. So any other questions?
Ma'am, another
Aisha, my dear?
question. Yeah.
Sure, please. I'm here.
Ma'am, mock exams are always being held at those places where the centers are being made.
No, Aisha, it's individual. You can do online also with me. No worries.
Okay, ma'am, like the live mock sessions. Ma'am, now at this
Uh,
time, Malaysia is not the
Yeah,
center,
last time,
so mock
yeah,
examination
last
is
time
also
I
not
went,
there.
yeah, this time because I don't think any of my Malaysian asked for it actually this time because they weren't there where they're reaching.
Okay, ma'am. Ma'am, like
Yeah,
Hong Kong or UAE, or like these
yeah,
places.
yeah, it's going to be there. I'll just guide you on this on the registration. The moment you'll get the seat, then we'll plan travel and then I'll discuss with you, okay? Individually, my
Okay.
dear. Okay,
Okay.
what is
Thank you,
best
ma'am.
for you?
Thank you.
Thank you, my
Okay.
dear
Thank
West.
you.
Thank you very much. Thank you. All right. Any other question? Great going. Thank you so much. All right. So with all this enthusiasm, which I can see today, I'm happy that you people are eager to learn. We have taken a decision of a short time. Now you have to prove yourself to be the best. People had been taking these steps and doing back-to-back MRCOT 3 after MRCOT 2. You have to prove yourself to be the same and be one of the RFA champions. I wish you all the best with all these prayers. Anytime, anything you feel, please do not hesitate. Until unless I'm in a live session, I've got 3 live sessions today. If I'm in the live session, there might be a little delay in responding, but the moderators and the technical team is 24/7 there. But just after the live session, and definitely scan all the WhatsApp, and I do respond to you guys. Anything, any concern, please do not hesitate to contact any of the team member. A happy RFA family. Let's make it a success. Thank you so much. Let's be together and let's make it a final destination. May the blessings be with you guys. Thank you so much. Bye-bye. The recording would be uploaded. Thank you very much for your precious time. Thank you. Bye-bye.